Before we begin the presentation, we would like to acknowledge the traditional owners of the land on which we meet and the ancestors past and present, the Aboriginal clan of the Torres Nation. We acknowledge that this land was also accessed by peoples of the Durawal and Torres nations. This group presentation consists of 4 members, including myself, Anissa, along with Jane, Madeline, and Jabir. I will be presenting on the links between Aboriginal and Torres Strait Islander culture and their health. Jane will identify and explain the social determinants that is relevant to the Aboriginal and Torres Strait Islander health, that is, income, employment, and education related to diabetes mellitus. Following Madeline, who will be explaining the cultural competency and safe nursing practice in relation to the remote community, the healthcare need, which is health promotion, and the health issue, that is diabetes mellitus. Lastly, Jabir will discuss a summary of what we as a group have come up with in regards to nursing practices that could improve in the Aboriginal and Torres Strait Islander health in the future. The links between culture and the Aboriginal and Torres Strait Islander health. The health and well-being of Aboriginal and Torres Strait Islander people is greatly influenced by their culture and spiritual connectedness to country. At times, these cultural aspects create differences in the Indigenous definition of health and well-being, as opposed to the Western's understanding, meaning the attitudes towards the well-being and health services are based on their traditional culture and belief system. With the Aboriginal and Torres Strait Islander people acting in accordance to their traditional culture, such being the art activities they implement, that is acting, dancing, storytelling, and singing, are known to have an effect in their personal and social living, as it produces different pathways to create and express oneself, and to encourage the communal act of sharing and receiving within the community. With this, it helps contribute in the health status, such being the elimination of anxiety and depression. Nevertheless, the Aboriginal and Torres Strait Islander population are known to have a higher percentage of susceptibility towards chronic illnesses, such as diabetes, than the general Australian population. A few of the greatest contributing factors to their health is poor nutrition and food availability, especially in the remote areas. This being reality, it is expected for the Indigenous people living with chronic illnesses to engage with health services. However, the expected rate of engagement with the Aboriginal and Torres Strait Islander people and health services is very minimal. Reasons for this may include cultural barriers, distrust in the government system, inappropriate actions made by healthcare staff such as racism and discrimination, limited health services in remote areas, and poor policy development. Moreover, the Indigenous community living in remote areas regularly feel the sense of burden when being cared for in healthcare facilities. This is due to them living away from their family and community. Additionally, dislocation from the country will result in the inability of implementing their traditional activities. With this, the Indigenous community living in remote areas prioritizes their relationships with their families and community, as opposed to focusing on how their lives could be prolonged, due to the lack of engaging with the healthcare system. Therefore, the traditional culture that the Aboriginal and Torres Strait Islander people adhere to can have positive influences in their health. However, due to the poor nutrition, food access, and the spiritual connectedness to country, affects their health and well-being. With a view towards the health services and the lack in trust with the government affects them getting treated and receiving a holistic health approach. Next, I would like to introduce Jane, who will be identifying and explaining the social determinants of health relevant to the Aboriginal and Torres Strait Islander population in the remote communities.
Within Aboriginal and Torres Strait Islander health, there are a variety of social determinants that affect their health and well-being. During this presentation, I will be discussing 3 social determinants of education, income, and employment. Education. The social determinant of education widely affects the health of Aboriginal and Torres Strait Islander communities, especially in relation to those diagnosed with diabetes mellitus. Education is linked with improved health throughout life as it assists people in achieving employment, income, adequate housing, provide for families, and handle ill health by making the most practical healthcare choices. Aboriginal and Torres Strait Islanders who have insufficient knowledge of the correct health and diet choices may result in suffering diabetes mellitus. Studies have displayed that the implementation of short-term healthy lifestyle seminars and programs conducted by the community for Aboriginal and Torres Strait Islander people to prevent type 2 diabetes have had a positive influence on their health for up to 2 years. Hence, it is crucial to provide education services regarding healthy lifestyle choices in remote areas for Aboriginal and Torres Strait Islander communities. Employment. Employment is a social determinant which plays a role in Aboriginal and Torres Strait Islanders' health and well-being, predominantly in regards to individuals who suffer diabetes mellitus. Involvement in healthy work ethic instills self-esteem, positive sense of identity, social interaction, and personal development that allow a person to better their everyday lifestyle and improving their overall physical and mental health. There is an 18% difference in employment for Indigenous Australians and non-Indigenous Australians, and as of 2012 to 2013, Aboriginal and Torres Strait Islander people had higher ratings of obesity, high blood pressure, smoke, suffer abnormal high-density lipoprotein, cholesterol, and triglycerides in comparison to non-Indigenous people. Therefore, there is an obvious need for employment opportunities for Aboriginal and Torres Strait Islanders in remote areas as they can improve lifestyle and lessen the chance of being diagnosed with diabetes mellitus. Income. In concern to the health of Aboriginal and Torres Strait Islanders, income is a social determinant that affects those who are diagnosed with diabetes mellitus. Having a higher income creates the opportunity for healthier food choices, adequate housing, greater access to services that provide health benefits, and pursuing better choices in lifestyle. On average, individuals who have higher incomes have shown to live longer and have better health in comparison to people with lower incomes. There is a large gap of mean gross income per week, as Indigenous households made $460, whereas non-Indigenous households made $740. Thus, this displays the disadvantage of Indigenous households, as having less income limits many services and lifestyle choices, which lead to diabetes mellitus. Next, I will be passing on my presentation to Madeline and Jabir, who will be addressing the culturally competent and safe care of a registered nurse in a remote area in regards to diabetes mellitus.
I will now introduce you to a video by the National Diabetes Services Scheme, which promotes the management of diabetes in Aboriginal and Torres Strait Islander communities.
Diabetes is a big problem in Aboriginal and Torres Strait Islander communities. About 1 in 3 people will get diabetes, and they'll need help to manage it. So what are the best ways to stay well when you've got diabetes? Let's ask Bob.
Hi, I'm Bob. When the doctor told me I had diabetes, I was worried about how it would affect me and my family, and what other people might think. The doctor told me I need to watch what I eat and be active to help me stay well. And I remember thinking, I need to be the help tackle on this one.
Heard you have diabetes, Bob.
Yeah, the doctor told me I have it. It runs in the family and it's a big problem in our communities.
So what will you do now?
The doctor told me I should join the NDSS.
What's the NDSS?
It's the National Diabetes Services Scheme. The doctor or a health worker helps you join and get the free NDSS card. You get cheaper products and lots of good advice and support to stay well.
What about when you travel?
No worries. I can use the NDSS card all over the country. Since I joined the NDSS and got my card, I get lots of support to keep enjoying life. cheaper products, and expert advice about eating well and staying active. And because the NDSS helps doctors and other health workers understand diabetes in our communities, other people will get the help they need too. The NDSS is free to join if you have a Medicare card. Ask your doctor or local health centre about joining the NDSS and help fight diabetes in your community.
The NDSS is funded by the Australian Government to support people living with diabetes and is run by Diabetes Australia. For more information, visit ndss.com.au or call 1300 136 588.
In this slide, I will be talking about how nurses demonstrate culturally competent and safe care towards patients with diabetes within a remote community. To begin with, I will explain why nursing practice should be culturally competent. One of the many roles a registered nurse has within the healthcare team is to provide ongoing assessment of a patient's health status and, most importantly, to monitor the patient's response to the plan of care. Because nurses are often the healthcare professionals who are required to spend the most time directly with patients, the ability to work efficiently whilst demonstrating culturally competent and safe care is crucial. With this understanding, I will explain the importance of culture within remote Indigenous communities. Across Australia, there are many remote Aboriginal and Torres Strait Islander communities that maintain strong connections with their traditional lands, culture and language. Traditional culture and belief systems continue to significantly impact the health of Aboriginal and Torres Strait Islanders as it helps with the process of coping with illness and death. Thus, to achieve culturally competent and safe care, nurses are required to understand and acknowledge the many belief systems within Aboriginal and Torres Strait Islander culture. So how do nurses demonstrate cultural competency? Cultural competency begins with comprehensive knowledge towards the diversity of belief systems in which each individual patient may practice. When implementing the care of a patient within remote communities, nurses must acknowledge the difference in attitudes towards health and the concept of well-being. For example, it is known that diabetes mellitus is 3 to 4% more likely to affect Aboriginal and Torres Strait Islander people living in remote areas as opposed to non-Indigenous people living in an urban or city area. To plan an intervention which showcases cultural competency, nurses must acknowledge the importance of Indigenous people and their spirituality. The distance between patients and healthcare facilities in remote communities causes an additional set of challenges in terms of a patient's willingness to travel away from family, work, and their homeland. Many Aboriginals and Torres Strait Islanders dislike travelling far distances because of their fear of dying away from their homeland, especially within a non-Aboriginal institution, as they believe their spirits are not able to rest with Mother Earth. This fear decreases their likelihood of them taking care of their physical health. How does cultural competency result in safe care? Safe care within remote communities of Aboriginal and Torres Strait Islander communities is achieved through awareness of issues such as this. It is necessary for registered nurses to plan healthcare interventions accordingly, such as allowing patients to receive the healthcare they need whilst maintaining their connectivity with their traditional lands, family and work. This is achieved through new healthcare innovations such as the use of remote monitoring devices. These medical mobile devices allow nurses to monitor the patient's health whilst respecting their cultural beliefs. Remote monitoring devices allow patient autonomy, as it requires the patient to routinely perform their own health tests such as a blood glucose test. This information is then sent to a general practice office so the healthcare professional can review the data in real time. Additionally, health interventions include promoting health awareness by educating the community about the prevention of diabetes through the intake of healthy foods, exercising, and limiting alcohol intake. Because Aboriginal and Torres Strait Islander communities are greatly family-orientated, one's educated understanding about diabetes can help the other family members through shared knowledge.
Thanks, Madeline. In conclusion, the points that was discussed in this presentation includes the links between the Aboriginal and Torres Strait Islander culture and health, which their spiritual connectedness to country that they adhere to had greatly influenced their health and well-being, the relevant social determinants of health of the indigenous people, their education, employment, and income, and the cultural competency and safe nursing practices in regards to diabetes mellitus in indigenous people. The purpose of this presentation was to bring awareness on the health of the indigenous population and what nursing practices should be implemented to benefit their health. Also to treat indigenous people with respect and their culture as well. It also demonstrates the importance of educating indigenous people, which can change their social, mental, and health status in the coming future.
The summary of this presentation is by acknowledging the culture of the Aboriginal and Torres Strait Islander people, we are able to understand their outlook towards their health and well-being. It is important that nurses are all culturally responsive to allow them to relate respectfully from their point of view and to able to work with them in personable and professional manner. The intercultural difference will take some time to close. Education is the best means for the nurses to educate indigenous people. By educating the whole community, we can reduce the prevalence of any disease. We can educate them with primary signs and symptoms when they should seek medical attention rather than making the condition worse. Explaining the importance of having a good, healthy lifestyle and the harmful effects of excess use of alcohol and use of illicit drugs. And in last, I will conclude by saying that we should treat all people, especially the Aboriginal people and Torres Strait Islander people, in a respectful manner and inform and provide all relevant informations about any conditions which could lead them towards leads them towards suffering and keep having them neglected. Thank you.